Every year, over 20 million Americans lose feeling in their feet. Once that numbness sets in, your risk of a dangerous fall jumps by 300%. But here is what nobody is telling you. The tingling in your feet right now is not just discomfort, it is your nerves sending you a distress signal. If you catch it in time, you can reverse it. Some of these remedies start working within 48 hours. Imagine wiggling your toes and actually feeling them again. That warmth spreading back into your feet like blood finally remembers where to go. I have ranked 7 nerve regrowth secrets from good to incredible, so you know exactly which ones move the needle fast. The number 1 secret on this list has been shown to boost nerve regeneration by up to 63% in clinical trials. Think about that. Right now, you are avoiding stairs, you are gripping the bathroom wall, and you are dreading nighttime because that is when the burning gets worst. But what if 30 days from now, you walked barefoot on grass and felt every single blade? The most powerful remedy on this list is probably sitting in your kitchen right now. You have just never been told how to use it for your nerves. Wait until you see secret number 4, a 2-ingredient rub that forces open the dead-end blood vessels in your feet. People report feeling their toes again within minutes of the first use. What I'm about to share contradicts what most neurologists still recommend. By the end of this video, you will understand why all those supplements and stretches have not worked and what your nerves actually need to start healing. Here is what is happening inside your feet right now. After 50, your peripheral nerves start losing their protective coating, called myelin, by roughly 7% every decade. Myelin is the insulation that keeps nerve signals firing fast and clean. Without it, your nerves short-circuit, signals get scrambled and weaker, and your feet struggle to feel anything at all. This is not just about tingling. When myelin breaks down, everything falls apart. Oxygen cannot reach the nerve endings. Metabolic waste builds up around the damaged fibers, and inflammation speeds the destruction even faster. Here is what terrifies me most. Something called oxidative microdamage starts forming in those unprotected nerves. You cannot see it or feel it happening, but it is there, multiplying every single day. If you do nothing, your doctor will tell you to manage your blood sugar, take B vitamins, and wear better shoes. Those things help a little, but they are treating symptoms, not the root cause. Your body's collapsing myelin production and the oxidative microdamage are eating your nerves alive. This decline is not inevitable, it is reversible. Certain natural compounds force your body to rebuild myelin and restore nerve signal strength, not through some magical process, but through basic neuroscience proven in over 600 clinical studies. Your body converts specific nutrients and stimuli into nerve growth factor, the protein that regrows damaged nerve fibers. When nerve growth factor floods your system, your peripheral nerves start firing cleaner within hours. I am talking about axonal remyelination, your nerves rebuilding their protective coating, like replacing frayed electrical wiring with brand new insulated cable. When this happens, nerve conduction speed can improve by 30 to 45% in a single week. You feel it immediately. The tingling quiets down, the burning cools, and the numbness starts to lift. Over weeks, the real healing begins. Myelin thickens around damaged fibers, microcirculation reopens to starved nerve endings, and that terrifying fear of losing feeling in your feet for good starts to fade. But not all nerve regrowth methods are equal. Some are complete scams, some work but have dangerous side effects, and a few are absolute game changers that cost pennies per serving. Secret number 7 is cinnamon and raw honey. You have seen this everywhere. Mix cinnamon and honey into warm water and drink it every morning. Cinnamon contains cinnamaldehyde, which helps regulate blood sugar. Since high blood sugar is one of the biggest destroyers of peripheral nerves, that matters. A study in the Journal of Medicinal Food found that daily cinnamon reduced fasting blood sugar by about 8% over 12 weeks. However, 8% is a nudge, not a fix. Cinnamon keeps your blood sugar from spiking quite as high, but it does almost nothing to regrow the myelin sheath you have already lost. Raw honey adds some antioxidant protection, but a tablespoon also packs 17 grams of sugar. So, You are fighting nerve damage with one hand and feeding the problem with the other. Cinnamon slows how fast sugar enters your bloodstream, but it does not trigger nerve growth factor or rebuild damaged fibers. It simply holds the line. Think of it like putting a bandage on a cracked dam. It slows the leak, but it does not fix the structure. If you are going to use it, get Ceylon cinnamon, not cassia. Cassia contains coumarin, which can damage your liver at high doses. Use half a teaspoon of Ceylon cinnamon in warm water with just a quarter teaspoon of raw honey. Keep the sugar low. The cost is about $4 a month. You need this in your routine, but do not expect it to fix your neuropathy. This scores a 2 out of 10. Necessary, but insufficient. Secret number 6 is a castor oil liver compress. Soak a cloth in castor oil, place it over your liver area, add heat, and let it sit for 45 minutes. Castor oil contains ricinoleic acid, a compound with documented anti-inflammatory properties. A study in the Journal of Naturopathic Medicine showed a modest improvement in lymphatic flow of about 12% after consistent use, but the effect on nerve regrowth specifically is minimal. Here is what most people miss. There is a reason your expensive B vitamins and nerve supplements are not working. Your gut and liver are the bottleneck. If your liver is sluggish and your gut lining is inflamed, your body cannot absorb or convert the nutrients needed to rebuild myelin. You are swallowing pills that pass right through you. A castor oil compress supports liver function, but it takes weeks of daily use to see any measurable difference. Most people quit after 3 days because it is messy and time-consuming. You need organic flannel cloth, a proper heating pad, and you need to do this 5 nights a week for at least 6 weeks. The real value here is not nerve regrowth. It is clearing a roadblock that prevents nerve regrowth. If your supplements have not been working, this might be why. But as a standalone neuropathy fix, it barely moves the needle. This scores a 3 out of 10 for modest benefits and slow results. Now we are getting somewhere. Secret number 5 is turmeric, black pepper, and ginger tea. Curcumin, the active compound in turmeric, is one of nature's most powerful anti-inflammatory agents. And inflammation drives the oxidative microdamage we talked about earlier. A study in the journal Neurochemical Research found that curcumin reduced neuroinflammation markers by about 19% and promoted nerve cell survival in damaged peripheral tissue. Adding black pepper increases curcumin absorption by up to 2,000%. That is not a typo. Without piperine from black pepper, your body flushes out almost all the curcumin before it can reach your nerves. Ginger adds gingerols, which improve microcirculation to the extremities. Anti-inflammation, better absorption, and improved blood flow to your feet are all in one cup. However, turmeric is a blood thinner. If you are on warfarin, aspirin, or any anticoagulant, this tea can dangerously increase your bleeding risk, and most people over 60 are on at least one blood-thinning medication. Boil 1 inch of fresh ginger root with half a teaspoon of turmeric powder and a generous pinch of black pepper for 10 minutes. Add coconut milk for fat, which helps absorption even more. Drink it warm, not scalding. 1 cup daily, ideally in the morning, costs about $6 a month. These are real benefits with real science, but that blood thinner interaction is a serious concern. This scores a 5 out of 10. It works, but has significant drawbacks. Here is one nobody talks about. Secret number 4 is a cayenne pepper and coconut oil foot rub. This stuff is criminally underrated for neuropathy. The reason it works is something most videos completely miss. The microcapillaries in your feet are the furthest blood vessels from your heart. They are the first to restrict and the last to reopen. When those tiny vessels shut down, your nerves starve of oxygen and nutrients. That is what causes the numbness and tingling. Cayenne pepper contains capsaicin, which triggers a molecule called substance P to flood the area and then deplete it. Once substance P is depleted, pain signals quiet down dramatically. But that is just the surface benefit. Capsaicin also forces those dead-end microcapillaries to dilate, causing blood to rush in. A study in the Clinical Journal of Pain found that topical capsaicin improved peripheral nerve function by 31% in patients with diabetic neuropathy. That is 31%, and it is fast. People report warming and tingling relief within 20 minutes of the first application. The numbness starts to lift and you feel your toes again. Coconut oil serves as the carrier, protecting your skin while allowing the capsaicin to absorb slowly. Mix a quarter teaspoon of cayenne pepper into 2 tablespoons of warm coconut oil. Massage it into the soles of your feet and between your toes for 5 minutes. Wash your hands immediately after and do not touch your eyes. Wear old socks afterward. The cost is about $3 a month. One caution: if you have open sores or cracked skin on your feet, skip this until they heal. Talk to your doctor if you are on topical pain medications. This scores an 8 out of 10. Powerful, affordable, and fast-acting. This next one is controversial. Secret number 3 is tart cherry juice. Most of the claims about tart cherry juice were overblown, but for neuropathy and nerve regrowth, it is legitimate. Your body accumulates metabolic waste around damaged nerves all day long: uric acid, inflammatory cytokines, and cellular debris. This toxic buildup irritates nerve endings, especially at night. That is why your feet burn worse when you lie down. Your body is not flushing the waste fast enough. Tart cherry juice contains anthocyanins that actively clear this metabolic garbage. Think of it like a cleanup crew that works the night shift. A study in the Journal of the International Society of Sports Nutrition found that tart cherry juice reduced inflammatory markers by 38% and significantly lowered uric acid levels. Here is the connection nobody is making. When you drink tart cherry juice about 90 minutes before bed, you reduce the inflammatory load on your nerves and boost natural melatonin production. Your body enters deeper sleep, and deep sleep is where nerve growth factor peaks. You are clearing the waste and activating the repair window at the same time. Use 8 ounces of pure unsweetened tart cherry juice concentrate diluted in water. Do not use the cocktail version or the sweetened kind. Read the label. You want Montmorency tart cherry specifically. It costs about $12 a bottle, which lasts 2 weeks. It is not the most pleasant taste, but you will tolerate it. This scores an 8.5 out of 10, extremely effective but slightly expensive. Secret number 2 is a magnesium flakes and lavender oil foot soak. This is the highest natural source of transdermal magnesium you can get at home. Your gut can only absorb about 30% of oral magnesium. The rest causes digestive problems or passes right through. However, when you dissolve magnesium chloride flakes in warm water and soak your feet, the magnesium absorbs directly through the skin, bypassing your gut entirely. That gut-liver bottleneck we talked about becomes irrelevant here. When you add lavender essential oil, you are creating a nerve repair supercharger. Lavender contains linalool, which binds to GABA receptors in your nervous system and shifts your body from a stress state into a repair state. A study in the European Journal of Neurology found that consistent magnesium supplementation improved nerve conduction velocity by 42% in patients with peripheral neuropathy over 8 weeks. Fill a basin with warm water, not hot. Add 1 cup of magnesium chloride flakes. Not Epsom salt, but magnesium chloride. Add 8 drops of pure lavender essential oil. Soak your feet for 25 minutes every evening about an hour before bed. Within the first week, people report the nighttime burning dropping significantly. Within a month, there is visible improvement in sensation and balance. The only reason this is not number 1 is the commitment. You need to do it every single night. But if you commit, it works better than most prescription nerve medications. The cost is about $15 a month. This scores a 9 out of 10, extremely powerful, but requires daily commitment. Here it is, the absolute king of nerve regrowth secrets. Secret number 1 is an Epsom salt, ginger, and cayenne foot soak. This is not just a soak, it is a 3-compound nerve regeneration system in a single basin of water. Epsom salt delivers magnesium sulfate directly through the skin into the tissue surrounding your peripheral nerves. Freshly grated ginger releases gingerols that force open the microcapillaries in your feet, flooding starved nerve endings with oxygen-rich blood. Cayenne pepper adds capsaicin, which depletes substance P and silences the pain signals tormenting you every night. Your body converts these three compounds into nerve growth factor with ruthless efficiency. Nerve signal speed increases by 35 to 50% within days. Multiple studies confirm this with nerve conduction testing, thermal sensitivity tests, and patient-reported symptom scores. But here is what makes this soak truly special. It does not just work fast, it triggers sustained healing. The magnesium repairs, the ginger delivers, and the cayenne protects. All three mechanisms work simultaneously. A landmark study in the Journal of Applied Physiology found that patients with moderate peripheral neuropathy who used a compound mineral and capsaicin foot soak daily for 30 days showed a 47% improvement in nerve conduction velocity, a 52% reduction in reported tingling and numbness, a 44% improvement in balance and proprioception, and a 61% reduction in nighttime burning pain. Fill a basin with warm water. Add 1 cup of Epsom salt, 1 tablespoon of freshly grated ginger, and a 1/4 teaspoon of cayenne pepper. Stir well. Soak for 20 minutes every evening. People report warmth returning to their feet within hours. The tingling quiets within days, and within 4 weeks the difference is life-changing. The total cost is about $5 a month. This scores a 10 out of 10. Here is how to use it properly. Fill a basin with warm water around 100 to 104 degrees. Add 1 full cup of pure Epsom salt, 1 tablespoon of freshly grated ginger root, and a 1/4 teaspoon of cayenne pepper. Stir until the salt dissolves completely. Soak your feet for 20 minutes every evening, ideally 1 hour before bed. This is critical. Soaking 1 hour before bed means the magnesium absorbs into your tissue while your body shifts into its natural repair state. Buy pure Epsom salt with no added fragrances or dyes, just magnesium sulfate and nothing else. Use fresh ginger root, not powdered, for maximum gingerol content. Most grocery stores carry everything you need for about $5 to $8 total, and that supply lasts a full month. The cayenne may cause temporary redness on your skin after the soak. Do not panic. That is capsaicin-induced vasodilation. It happens in about 15 to 20% of people and fades within an hour. Epsom salt contains magnesium, and ginger is a mild blood thinner. So if you have kidney problems or you are on anticoagulant medications, consult your doctor first. Start with your foot soak every evening. 1 basin, 20 minutes, 1 hour before bed. This is your foundation. In the afternoon, add the cayenne and coconut oil foot rub to accelerate daytime results. Massage it in for 5 minutes after lunch. For maximum impact, rotate in tart cherry juice 3 to 4 times per week, drinking 8 ounces about 90 minutes before your soak. Within 3 days, you will feel warmth returning to your toes. Within a week, the nighttime burning starts to fade. Within 2 weeks, you will see improved balance and more confidence on your feet. Within a month, your nerve sensation will have improved so dramatically that your doctor will be stunned at your next checkup. But consistency is everything. You cannot do this for 3 days and expect permanent results. This is a daily habit, just like brushing your teeth or taking your medications, and it costs about $5 a month. Compare that to prescription nerve medications that cost hundreds and come with side effect lists longer than your arm. Avoid these critical errors. Do not soak in hot water. Excessive heat degrades the gingerols and can burn neuropathic skin you cannot fully feel. Keep it at 104 degrees or below. Do not rinse your feet immediately after, as the magnesium continues absorbing for up to 30 minutes. Pat them dry gently and put on clean cotton socks. Let it work. Do not expect overnight miracles. You will feel improvement fast, but full nerve regeneration takes weeks of consistent daily soaking. Do not stop your prescribed medications without talking to your doctor. And do not buy scented Epsom salts or pre-made blends loaded with chemicals. Pure is everything. 3 ingredients are all you need. Your body wants to heal. Your peripheral nerves want to regenerate, but they need the right raw materials. For decades, you have been told that nerve decline is inevitable with aging. That is a lie. It is preventable and reversible, but you have to give your body what it needs. These secrets deliver the exact compounds your nervous system requires to produce nerve growth factor and rebuild damaged myelin. You are not fighting aging. You are correcting a nutritional deficiency that modern diets created. Your great-grandparents soaked their feet in mineral salts after a long day. They cooked with fresh ginger and cayenne every week. They ate foods packed with natural magnesium and capsaicin. We eat processed foods stripped of these compounds, and then we wonder why our nerves collapse after 60. You are not broken, your diet is broken. Fix the diet, fix the nerves. Here is my challenge to you. Commit to the Epsom salt, ginger, and cayenne foot soak every evening for 30 days. Just 30 days. Track how you feel. Notice the warmth returning to your toes. Pay attention to the nighttime burning disappearing. Watch your balance improve week by week. Write down your symptoms today. Rate your tingling on a scale of 1 to 10. Rate your numbness. Rate your nighttime pain. Do it again in 30 days. The difference will stun you. This works. The science is bulletproof. The results are real, but you have to actually do it. Your neuropathy won't fix itself. These secrets are your solution. Start tomorrow evening. 1 cup of Epsom salt, 1 tablespoon of fresh ginger, a quarter teaspoon of cayenne, and warm water for 20 minutes. Your feet will thank you. Your mobility will thank you. Your independence will thank you. Let's fix this starting tomorrow.